Good morning. My name is Daniella. I'm going to present a little about breath acetone chains in advanced heart failure patients on inotropes. I don't have any conflicts of interest. Exhaled breath acetone is a biomarker of heart failure diagnosis and chronic heart failure prognosis. The line of this research originated from a clinical observation. Heart failure patients, when are in decompensation, they emit a distinct odor. The first study with 89 heart failure patients showed that EBA can be considered a proper biomarker of heart failure diagnosis since EBA levels were higher in heart failure patients when compared to the control group without comorbidities, with P less than 0.001. In this data, EBA levels were showed elevated among heart failure patients with progressive increment according to functional class decline. EBA levels greater than 1.16 were used for the diagnosis of heart failure, and EBA levels greater than 2.5 were used for the diagnosis of heart failure decompensation, with area under the ROC curve values very similar to BNP. 1 year follow-up data showed that EBA levels greater than 3.7 were associated with an increased risk of death or heart transplantation. Although limited in its statistical power, such study was an important hypothesis generator regarding the important prognostic representation of this biomarker. But the role of EBA in advanced heart failure patients is unknown. In this study, our aim is to study EBA chains in decompensated heart failure patients admitted to the emergency room requiring inotrope use. Our study is a single-center, prospective, and observational one. Patients admitted to the emergency room in need of inotrope were invited to participate in this study. Breath collection using a portable, non-invasive device previously developed and described was performed at admission and after 48 hours. The samples were analyzed by spectrophotometry after erection with salicylaldehyde. The Institutional Ethics Committee approved the study. Wilcoxon test was used to compare EBA levels in the two collected samples, and SPSS was used for statistical analysis. All patients had 2 collected samples analyzed. 70 patients were included in this analysis. Most patients were male, 71%, mean age 54, more or less 12 years, mean ejection fraction 25, more or less 6%. Most patients had dilated and ischemic cardiomyopathy. As you can see, the median concentration of EBA at admission was 8.5, and after 48 hours of inotrope initiation was 2.2, with P less than 0.001. The reduction of EBA is in line with the improvement in right and left heart failure symptoms, with P less than 0.001. And to conclude, our data review high levels of EBA in stage D heart failure patients, and EBA levels decreases soon after inotrope initiation, reinforcing previous data on EBA as a biomarker of heart failure severity. Thank you very much.
Questions from the audience?
In Portuguese, please. No problem.
Wish I could. We're from Brazil.
Everything is from Brazil now.
Yeah.
Yes,
I live in Rio.
Brazil.
They live in São Paulo. She lives in a beautiful city. Espírito
Yes.
Santo, Vitória. Daniela, congratulations for your brilliant presentation. I have 2 questions. I imagine that this biomarker probably is not specific for heart failure. So my question is, how it is affected by comorbidities such as decompensated diabetes, COPD, sepsis, things like that. And the other question is, did you compare to NT-proBNP in your work?
Good question. Thank you for your question. First, it's an important question because in your data we excluded renal dysfunction and diabetes, the first study. But the second, we included them. And there's not different between above. And about the second question, please? Okay. Yes, we did. And the rock curve values was very similar.
Any other question? Daniella, I'd like to know that this study, all the study was based on the smell of the exhaled breath of acute heart failure patients. Can we say that the most of this smell is acetone?
Yes.
Or there is another component. Thank you.
Yes. Great question, Professor. The first bispectrophotometry, we saw only acetone. It's fantastic data.
Perfect.
Yes. And you intend to evaluate the prognostic value of this biomarker in advanced heart failure. Maybe in the next year you can present.
Perfect. Thank you.
Thank you very much.